Good morning, guys. This is the Now Morning Show. And as you know, October is Breast Cancer Awareness Month, hence my pink. But did you know that October 1st is also International Day of Older Persons? It's when we pay some attention to the persons who may be part of our aging population. And since breast cancer does affect our aging population, our next guest will shine some really needed light. Joining us via Zoom, that is Dr. Marie Musuddin, the acting head of radiology, as well as Dr. Leanne Cornett, the assistant medical director, both from the SWRHA, as we talk breast cancer awareness and the golden years. Doctors, good morning and welcome to the Now Morning Show.
Good morning.
Good morning. Thank you for having us.
It is necessary that you join us because all month long we will be having these sorts of conversations, particularly where breast cancer is concerned, as the awareness is necessary for this month. So granted that we may be familiar, let's start with you, Dr. Musuddin, giving us a bit of a brief overview of breast cancer, specifically here in Trinidad and Tobago.
Hi, good morning. Thank you for having me. Well, first, let's talk about some breast cancer statistics. 1 in 8 women will be diagnosed with breast cancer in their lifetime. Why breast cancer is so important and awareness is so important is that within Trinidad and Tobago, it is the most common cancer occurring in women, and it's the most common cancer causing the death of women. That is the cancer with the highest mortality rate. That is why the early detection of breast cancer is so important, so that we need to reduce those mortality rates from breast cancer.
It sounds like things like screening and early detection will be a very serious area to focus on. So perhaps, Dr. Cornett, you could give us some insights as to what sort of facilities are available to us here in Trinidad and Tobago then? Specifically for screening and early detection.
Okay, thank you so very much. So when we're looking at screening for breast cancer, we're basically looking at testing for persons who are healthy, persons who are well, persons who are asymptomatic. And the good thing is that at the Southwest Regional Health Authority, our primary care doctors and our health promotion department, as well as our secondary care facilities, all help with breast cancer screening. We help by education, talking to our population of the Southwest Regional Health Authority on the importance of screening for breast cancer. We also teach on breast self-examinations. We examine our patients' breasts and we refer them in the primary health facilities. We refer them to the secondary health facilities for screening mammograms. And in secondary care facilities, we perform the screening mammograms for these patients. So we are focused a lot on prevention and screening, because 1/3 of the cancers worldwide are preventative.
Well, that's actually kind of relieving that it is preventative, but also that we have the support should you need it. So, Dr. Musuddin, can we get a little bit more insight into what is most prevalent in Trinidad, specifically with the aggression of the cancer, and perhaps even what we should be looking for when we talk about that at-home screening?
Okay, so as Dr. Cornett said, with respect to screening, it means the patient is asymptomatic, that they don't even have a lump yet, right? And that is the most common presentation of breast cancer, a lump. So we want, and the mammogram, the screening mammogram, can actually detect the breast cancer 5 years before the person actually feels the lump. And the reason why this is important is the relationship with what we call staging or early detection and prognosis. For example, if we detect that cancer as less than 2 centimeters, right, which is what we call stage 1 cancer, the 5-year survival with appropriate treatment is 98%. If we go on to stage 3, in other words, that the woman presents with the breast cancer when it's above 2 or 5 centimeters, that prognosis in 5 years, that survival percentage falls to roughly 50%. So you see there's a sharp drop depending on what size we detect that cancer. And this is why we always stress that the early diagnosis is linked directly to the percentage of survival in 5 years. So this is why we want patients to come for their screening mammograms. And this is why we want patients, when they feel a lump, not to hesitate, but to come in one time to your local health center, to your general practitioner, who will then refer you for the mammogram.
Well, the good thing about those statistics, even though we see the decline over time, we are still seeing positives in terms of the mortality, well, the ability to survive. That means that we have the
Correct.
support.
Correct.
That means that the information is out there. So, Dr. Konya, tell me a little bit as to what the awareness campaigns for this month would look like from the Southwest Regional Health Authority then.
Okay, so thank you so very much again. So at the Southwest Regional Health Authority, what we're trying to do again is promote cancer screening, early diagnosis, because what we really want to do is to cure cancers. We don't want persons coming to us when it's too late. So what we have been doing, or what we plan to do for the next few weeks, is going out to the communities. At our local health centers, we are going to promote cancer awareness and cancer screening. We are going to go out to our malls. We're going to go out to the rural areas and talk about cancer, encourage screening for breast cancer. And that's our plan for this month as we try to not just focus only on this month of October as Breast Cancer Awareness Month, but we're just trying to even push all our attention so we can get more and more persons coming to us for screening because we want to diagnose earlier.
Sounds like a plan. Now, Dr. Musidin,
Yes.
in terms of some of the insight that you were sharing with us, we talked about at least one method of screening and that early detection. Are there other options that you can let us know about this morning?
Right. So mammography is the only thing that has been proven by the studies to decrease the mortality rate from breast cancer. But I want to touch on a lot of patients, up to 50%, when they do get their mammogram, may be required to get an ultrasound. And at this point in time, patients start to panic. The doctor sees something, do I need to be worried? Now, the reason for this is because in Trinidad, our population and younger patients, about 50%, have what we call dense breast. And the reality is that this is going to look white on the mammogram, but the cancer is also going to look white on the mammogram. So sometimes we might need a little help with that mammogram. You may see that you are advised to get an ultrasound based on your breast density. And again, this is offered at the Southwest Regional Health Authority, both at some of our district health facilities, as well as at San Fernando General Hospital and Point Fortin Hospital.
Okay. Now, should there be particular age groups, because you're mentioning even in the younger population, you're seeing a lot of high density in the breasts, and that could be concerning, it seems. Are there age groups that we should start putting a little bit more focus on those sorts of checkups versus others?
Right. So the World Health Organization, the screening guidelines, this is what we follow in Trinidad and Tobago, is that you get screening. This is your screening mammogram every other year from the ages of 50 to 69. And this is if you're at general risk. I would advise that patients who have a high risk, meaning that you have a history of breast cancer in your immediate family, your mom or your sister, or you have been diagnosed with the BRCA1 or BRCA2 gene, that they can start their screening earlier, between 40 and 45, and have it every year. And again, be aware that if you're younger, you are more likely to have a combination of the mammogram and the ultrasound to complete the study.
Okay, so we have a couple of methods covered. Tell us a little bit about biopsies, because granted that we talk about cancer so much in society, we kind of know, but we need a little bit of a refresher.
Of course. And again, I want to remove the fear, because when a patient hears that they need a biopsy, they start to panic immediately. So when a patient feels a breast lump, right, 9 out of 10 times, it's going to be something benign. So again, I want to stress to these ladies that we don't sit down and worry about it. We go to our healthcare provider and let us get our mammogram, let us get our ultrasound. Us as the radiologists who are looking at your mammogram and your ultrasound will say, okay, this looks benign, that is non-cancerous, or this looks like cancer, right? And that again is in the minority of patients. And we may schedule you for a biopsy. If the lump is what we call palpable, the surgeon or the referring doctor might do it in his office. If it is only seen on the mammogram, which is what you get when you do a screening mammogram or an ultrasound, they will refer you back to the radiology department to use that mammogram, to use that ultrasound as your eyes. And again, this is a day procedure. It might last half an hour for the most. It's an outpatient procedure. We give you a little bit of local anesthetic. We take 2 or 3 samples, and then we send that to the pathologist who looks at it under the microscope to give us a histological diagnosis, because that's where cancer is definitively diagnosed. So again, now that we're informed, we're not going to panic if we hear that we need a biopsy.
Doctors, I really appreciate the insight, because you're very right. It is relieving to have the information so you can make the best choice for you and not panic. But we've been talking about how much it impacts our younger population and particular age groups. But we really do know that we have an aging population. And so tell us how the SWRHA is focusing on the golden years. Let's start with you, Dr. Konya, telling us a little bit about what is planned.
Sure. Now, October the 1st, every single year, is considered the International Day of the Older Persons. And this basically started since 1990, when the United Nations General Assembly basically designated this day as a day for older persons. And when we look at the demographics worldwide, regionally, and even locally, we see that there's an aging population. The pyramid, with respect to age before, used to have the base for the younger persons having the higher percentage of the population. But what we're seeing now is persons over the age of 50, that area in the pyramid being expanded. In fact, in Trinidad and Tobago, 13.4% of our population in the year 2010, according to the national census, were persons over the age of 65. And it is projected that by 2025, we're in 2024 now, it's projected by 2025, this percentage of older persons to increase to 20%. And with aging, it brings along many, many challenges. So, for example, what we see at the Southwest Regional Health Authority, which is what is seen by the other regional health authorities, we see older persons presenting to us with falls, with acute confusional state, with cognitive impairment, urinary incontinence, polypharmacy. So these are what we call the geriatric giants. And with the Southwest Regional Health Authority, we remain fully committed to the strategic goals of the Southwest Regional Health Authority. So we want to help our older persons as they age, because what we want to promote is something called healthy aging.
Right.
So one, because 1/3 of cancers are preventative, we are going to promote preventative care in our older persons, as well as, of course, our younger persons. So we're going to look at all the risk factors that can increase your risk of cancer. So we're going to talk about, and we talk regularly about, cessation of tobacco smoking, exercise, lifestyle change, because all those things can impact on your health. So, for example, at the St. Madeleine Local Health Center within the last month, they basically had a day in which they focused on the older adults. There were physiotherapists, there was someone doing exercises or physiotherapy. We at the Southwest Regional Health Authority, we have dietitians at all our facilities, and we have 3 district health facilities. So we have dietitians available at all these health facilities, even our health centers. And these dietitians, of course, we put our older persons to them, because as you get older, you may have more and more comorbidities, and we at least we want to promote lifestyle change. So we have the dietitians, we have physiotherapists, we have doctors, we have nurse educators, we have the district health nurses who will go out in the community as well with the doctors to promote screening and to promote prevention, promote immunization. So we are really committed to our older adults with the Southwest Regional Health Authority.
Sounds like a solid plan. Now, Dr. Musadeen, before we wrap things up, anything that you'd like to add for either of those demographics, the breast cancer susceptible or those impacted altogether, or the ones who are enjoying their golden years?
I would just like to add with a combination of both things, right? Because the youths now are the ones who are going to be enjoying their golden years. And this is what we want. We spoke about curing cancer before. We want you to be aware of your health, whether it be breast cancer or anything else, to be aware. We want so that when you come in for your screening mammograms and so on, that we diagnose it so early and we're able to what we call cure you, right? So that there is no trace of cancer. Because I have a lot of patients who have been diagnosed early and they live to see their grandchildren. The cancer, regardless of what type it is, has now become like a chronic disease. Oh, I had cancer, I've survived cancer, and they're enjoying seeing their grandchildren growing, passing SEAs. I have stories of getting married and things like that. So this is what we want, that we get this cancer diagnosed early, it becomes curative, it becomes like a chronic disease, and you are able to enjoy your golden years later on.
And for that, we appreciate your time and your messages, doctors. So thank you very much for joining us this morning, and we look forward to continuing to support your endeavors all month and beyond.
Thank you very much for having us.